Good afternoon and welcome to this week's Tuesday education session, the first one for the fall semester. My name is Peggy Rauman and I'm a registered nurse and nurse consultant for policy and practice here at the college. My colleague Michelle Carpenter, she is here with me as well. She is also a registered nurse and nurse consultant for policy and practice. Today's topic is timely as over the past year, virtual ERs have become a necessity in some areas without on-site physician and/or NP support. We have received several calls from registrants regarding their professional expectations when working in a virtual ER. So we thought it would be important to share this information with all. The information that is provided today is current as of today's date. So just a little overview. The decision to establish virtual ERs is an employer decision based on a set of extenuating circumstances. These types of decisions are not made lightly, and they involve expertise from various stakeholders on the best options to provide emergency care to clients and to the community when traditional emergency services are not available. The college does not regulate the employer, only individual RNs as self-regulating professionals. However, the employer cannot make a policy that is contravening to the RN Act or regulations, or the standards of practice or the scope of practice as set by the college. Therefore, the content of this presentation will focus on regulatory tips and individual accountabilities when working in a virtual ER. We will begin by speaking a little bit about being a self-regulated professional. Then we're going to talk about the standards of practice, scope of practice, and virtual nursing practice. So where does self-regulation come from? I was just going to give you a little bit of history. So the original Newfoundland Registered Nurses Act was passed in the House of Assembly on May 20th, 1953, and it came into effect on January 1st, 1954. And this act remained largely unchanged until 2008, when Labrador was added to the name, and it officially became the Registered Nursing Act. And that was passed in the House of Assembly on June 4th, 2008. This Registered Nurses Act gave nurses the right to regulate nursing in the province, and it gave RNs the responsibility to protect the public. The right to self-regulation is important because only nurses have the experiential knowledge of what it is like to go to nursing school, to do the laboratories and clinical placements, to know what is taught, and to know what it is like to do the work of a nurse. So it only makes sense that nurses self-regulate. So way back when, it was difficult for nurses to enforce the Registered Nurses Act and to ensure that practicing nurses were staying on track. So the regulatory body, or the college, was created, and the college was then given the authority to set the scope of practice for nurses and gave nurses their protected title. So prior to the Registered Nurses Act and self-regulation, everyone, regardless of their education or experience or knowledge, could claim to be a nurse, and they could potentially try any treatment despite it being potentially harmful to the public. So the college's responsibility to regulate the profession and protect the public has not changed, and neither has nurses' commitment to the people of this province. So when we're talking about self-regulation, we're really talking about accountability. So what does it mean to be a self-regulated professional? As a self-regulated professional, you are accountable or answerable. So you're answerable and responsible for your actions, your inactions, judgments, and the consequences of those actions or any outcomes. So as a nurse, you are in a privileged position. Only you know what you are doing with the client. No one follows you into a room to provide patient care. So if you're doing a dressing and break sterile technique, you have a choice to make. You can get a new dressing tray and start again, or you can just continue with the dressing. Maybe nothing happens. But if the client gets an infection, then you are answerable for that decision that you made. So part of being answerable or accountable is that we accept our obligation to uphold the professional, ethical, and legal aspects of nursing practice and accept responsibility for not only the nursing services we provide, but for carrying out those services in a safe, competent, compassionate, and ethical manner. So just to reiterate accountability, it means answerable for what we do, for how well we do it, for what we decide not to do. And we are answerable to, first and foremost, the client, then our employer, to legislation or law, to working within our scope of practice, and to knowing the scope of practice or asking about the scope of practice of others. So with this now, we're going to segue into the standards for nursing practice. So how does your standards apply in a virtual ER? So keep that question at top of your mind as we go through this section of the presentation. So we all know what our standards are. There are our broad, authoritative, principle-based statements that articulate the conduct or performance expected of registered nurses and nurse practitioners. And the primary purpose of the standards is to describe the minimal level of performance expected of registered nurses and nurse practitioners, including intern license holders, in their practice, and that's against which their actual performance can be registered. And all RNs and NPs are responsible for understanding their standards and applying it to their practice setting or where you're located. And the standards are interrelated and they're intended to be dynamic to describe safe, competent, compassionate, and ethical expectations across all settings and all domains. Now, the first picture is a graphic of the standards, and as you will see, the first 4 standards are specific to RNs, and the next 3 standards are specific to NPs because of their advanced level of graduate education, skills, and competence. And those standards represent those advanced skills and knowledge. So as NPs, all NPs are RNs first and foremost, so they must adhere to all 7 standards. The second graphic there depicts the expectations for practice, and there's an expectation to maintain public trust, adhere to legislation, to the standards, to the code, to any specialty standards. So there might be specialty standards that you must adhere to in your employment setting. But you must also adhere to your employer guidelines. And ultimately, as with every decision, everything that we do must be in the best interest of your clients. So now we're going to pick out an indicator from each standard and just reflect on it. How does this indicator apply in a virtual ER? I'm not going to go through all the standards and all the indicators. We all know our standards and our indicators, but I just picked out a couple from each standard so that you can reflect on your accountability for that standard in a virtual ER. So standard 1 is responsibility and accountability. So the registered nurse and nurse practitioner are responsible for practicing safely, competently, compassionately, ethically, and is accountable or answerable to the client, the public, the employer, and the profession. So indicator 1.2 says that you practice in accordance with relevant legislation, standards, regulatory requirements, and employer policies. So how does this indicator relate to your practice? Can you say that you follow your standards and other regulatory requirements in a virtual ER? And how does your employer policy dictate what your practice expectations are in that virtual ER? Do you have an employer policy? And if you do not, then you have the right to advocate for something to be written to outline your expectations. Standard 2 is knowledge-based practice. The registered nurse and nurse practitioner practices using evidence-informed knowledge, skills, and judgment. So I picked out just one of many indicators, 2.3. So you recognize and practice within your individual level of confidence and seek additional supports when needed. So, in a virtual ER, depending on your roles and responsibilities and your accountabilities as outlined, you might need, to get some additional education. You might need to bring it to your employer's attention that about your individual level of competence, what those things you have the knowledge, skills, and judgment to do, and then ask for that additional support. And competence is going to be defined in scope of practice, and Michelle's going to be talking about competence shortly. So you have to think about, in a virtual ER, are you competent in that setting? Standard 3 is client-centered practice. The registered nurse and nurse practitioner contributes to and promotes measures that optimize client health outcomes at the individual, employer, and system level. And the indicator that I picked out, although there's many, is 3.5. So upholds and protects client privacy and confidentiality in all forms of communication, including but not limited to e-records, verbal, written, and social media. So how does this work in a virtual ER? How are you doing proper patient identification to whoever you're consulting with? How do you get information from a virtual realm into documentation? There is greater risks for breaches in privacy and confidentiality when you're doing things virtually. And the last standard that I'm going to talk about is the last of the registered nursing standards, Standard 4, professional relationships and leadership. The registered nurse and nurse practitioner establishes professional relationships and demonstrate leadership to deliver quality nursing and healthcare services. And 4.3 is communicates effectively and respectfully with other team members to promote continuity and delivery of safe, competent, compassionate, and ethical care. So in your virtual setting, can you communicate effectively? And we're going to talk about virtual nursing care soon. So I'm now going to turn over the presentation to Michelle, and she is the lead for NP practice in Newfoundland and Labrador, and she's going to talk about the next 3 NP specific standards.
So under the NP standards that are specific, standard 5, 6, and 7, there are performance indicators that are applicable to virtual nursing practice. For example, under standard 5, which is collaboration, consultation, and referral, and that standard says that NPs collaborates and consults with the client and interprofessional team members in the provision of care to optimize client outcomes. So I chose 5.5, transfers care if the client's care needs are beyond the NP scope of practice. And under that standard, when we indicator, when we reflect on that, there may be competencies that are required in an ER, virtual ER, that is beyond the NP scope of practice. They may not have the necessary knowledge, skills, and judgment. And in that case, they might have to consult, they may have to transfer care, or they may have to do a referral to another healthcare professional. So, for example, if you're in the ER and the NP does not have individual competence with severe head injuries or concussions or complex traumas that may be associated with an MVA, then you may have to seek guidance from another healthcare professional, or you may have to transfer that care. Another competency that may not be within the NP scope of practice is intubation. And this is not an entry-level competency at present, but an NP may have gotten it through continuing education and in the environment, but the work environment. And then if that is required and you don't have that individual competence, then you're going to need to either transfer the care or seek additional supports so that you can bring that into your scope. And I'll talk about that a little bit further in the presentation. So then under standard 6, assessment and diagnosis. So the NP provides a relevant assessment, diagnosis, health conditions and illnesses, and communicates the diagnosis, prognosis, treatment options, and expected outcomes to the client within the NP's category of practice, scope of practice, and level of competence. So the indicator I chose then is performs an assessment appropriate to the client's situation. And in virtual nursing practice, the NP must perform an assessment that is appropriate to the situation. So when using virtual platforms, determine when a comprehensive or focused assessment is appropriate. So, when you're working in these virtual ERs, you need to determine how you're going to do that assessment using virtual nursing platforms. And you need to determine, do you have access, for example, to a digital stethoscope or a digital otoscope? So what tools are out there that can assist you in performing your assessment? And you need to reflect, am I able to perform an assessment using the virtual platforms such as telehealth, FaceTime, some type of video platform, telephone? So you need to determine what type of assessment is possible. Are you able to complete the assessment that is required in that situation? Then under client care management, the NP in the management of client care selects from a range of interventions, which may include but are not limited to procedures, both invasive and non-invasive, pharmacologicals, including controlled drugs and substances, non-pharmacological, blood and blood products, medical gases, complementary and alternative medicines, medical and health supplies, as well as relevant programs and services. And under this one, I chose 7.1, obtains and documents informed consent from the client or substitute decision maker. So as Peggy mentioned, you really need to determine how you're going to get the proper patient identification. So how do you identify that the client that is on the other end of the platform, virtual platform, is who is intended to be? And then you need to get that consent. So when participating in virtual nursing practice, it is essential that the MP obtain the necessary consents, for example, informed consent, and document consent that has been obtained. So this is extremely important that you do that documentation. It is extremely important in virtual nursing practice. The client needs to know the strengths and limitations of the platform, including any material risk associated with the treatment or care versus via virtual nursing practice. So you need to have that discussion with the client on, what is expected using virtual nursing practice when you're providing care. And clients must be screened to determine if virtual nursing practice is appropriate for their healthcare needs. The MP must also determine and use their critical judgment to determine if a physical assessment is required to be completed with the assistance of a third party. For example, in virtual care, the RN that is present in the virtual, in the ER, and the MP is providing services through virtual, the RN may place the digital stethoscope, or they may remove a dressing for viewing of a wound. So there's certain things that you need to consider in that client care management, and you need to obtain consent and ensure that you document that consent. And part of consent is your discussing with the client the risk and the benefits and what is expected of care provided through virtual nursing practice. So now we're going to talk a little bit about scope of practice. And if you're not aware, Council approved in June a new scope of practice framework. This is on our website for your review. It was created as a framework, and then we have a suite of supporting documents to make it easier for RNs and MPs to answer the question, am I allowed to do that? So when we talk about scope of nursing practice, we're referring to the range of roles, functions, responsibilities, and activities which RNs and MPs are educated and authorized to perform to assist clients to achieve health. And a scope of practice statement identifies the boundaries of a discipline. So when we're talking about scope of practice of RNs and MPs, we're talking about what are the boundaries, what competencies are an MP or an RN educated and authorized to perform within their individual competence. So when you're answering the question, am I allowed to do that? RNs and MPs must consider three principles or elements. And one is, am I educated? The other is, am I authorized? And the third is, am I competent to perform this competency? And in this slide, we're going to look at, are the individual RN or MP educated to perform that competency? And can I, in virtual nursing practice, can I do this competency virtually? Is it essential to reflect on this consideration? Do you have the education to do that competency, and can I perform it through virtual nursing practice? So when we look at, am I educated? And this is a really important one to think about. You get entry to practice or entry-level competencies when you complete your nursing program, whether that is your Bachelor of Science of Nursing or your nurse practitioner program. And so you have those competencies that come from your nursing program. But then we can also bring into your scope of practice competencies that are gained through continuing education. And in continuing education, there can be formal education. For example, you may do a course online, you get a certificate when you successfully pass that course, or it could be informal. It could be, at the bedside, the clinical educator provides you some theory about a new condition that is on your unit. And there's a procedure that has to be completed to address that client's need. And there's a practical there. So it could be, as I said, it could be through formal or informal continuing education, but in either one of these, there has to be a theory and a practical. So really important that it's not just enough that someone shows you, how to do a procedure. You got to have the theory behind it. Now, again, that could be very informal. It could be very short duration of that education, but you have to have that theory and practical. And then there has to be a method of validation. So someone has to deem that you're competent in that competency. Now, the CRN does not deem what is the requirement for validation. That is an employer validation process that would be used. So in some RHAs, it could be you have to demonstrate that skill competently 3 times. It could be a matter of performing it 5 times. It could be 1, but the employer will set that standard. And in MP practice, their education programs currently, you receive education either in family all ages, adult pediatric education, and under pediatric, there's neonatal, but this could be changing in the very near future to one category of practice for their education program. So I just want to mention that. But so that's the information that will allow you to consider when you're being asked to do a competency using in virtual nursing practice or virtual ERs. Am I educated? So if a client comes in and you're being asked to do intubation, you got to think, okay, am I educated? So then we're going to look at the next element to consider, authorization. Am I authorized to do that? An authorization to carry out activities in the practice setting, you need to think about 4 categories of authorization, and they must be in place for an RN or MP to perform a nursing competency. So the first thing that we look at is legislation. So is those activities must be carried out in accordance to various federal or provincial legislation that governs or directs nursing practice. So what we mean by, is there anything in legislation that would prevent you from performing that competency, or that allows you to do that competency? For example, the Federal Food and Drug Act and regulations prevents registered nurses from giving out drug samples. So if you're in a virtual ER or you're in an ER, RNs cannot give out drug samples. But there was a change to that federal legislation, and as of 2021, MPs can now do that, but RNs are still not allowed. Even if the NP gave a drug sample to an RN and said, give this to a client, that's not permitted. Then is there anything in at the college, the College of Registered Nurses of Newfoundland and Labrador, is there anything that we say that cannot be within the scope of a registered nurse or a nurse practitioner? Or are there any practice or education requirements that need to be completed before you're authorized to perform that competency? And one that comes to mind is that for MPs to prescribe Suboxone and Methadone and Sublocade, they have to complete specific practice and education requirements and be granted prescriptive authority for those medications. And then we think about the employer. So these activities are authorized by the employer as approved nursing practice in specific employment settings. So does the employer have a policy, a guideline, a job description, a care or medical directive that authorizes you to do that competency in that particular practice setting? So does the employer authorize you to do that in your practice setting? And if that is a need and you don't have that authorization, then have that discussion, advocate with the employer if you require that authorization. And sometimes that doesn't necessarily have to be a policy. It can be a guideline. In some circumstances, it could be like an email from professional practice or your manager in a emergency situation where you may be given authority to perform that skill. And then at the end, it's the client. And in this authorization, the client authorizes you through informed consent to perform that competency on them. So at the end of the day, you can have all the authorization you want, but if the client says, oh, no, I don't want that to be done to me, then you can't proceed. So as I said, employer authorization comes in many forms. It could be through employer policies. It could be a guideline. It could be a clinical decision tool. It could be through your role or job description. It could be through a medical directive, and through this new suite of documents, we call them care directives, but it's the same thing. It's medical directives. It could be through a pre-printed order. It could be through delegation. So in an emergency circumstance, with the permission of senior management, and then with the physician, you may be delegated to perform a certain competency. And I encourage you to go to the scope of practice framework to learn more about these forms of authorization. And all of us, as a registered nurse or nurse practitioner, gets authorization to perform care through an assignment of care. You're assigned to provide care to a group of clients in your practice setting. And then the final element to consider is, are you competent? So when I'm thinking about, so I'm educated, I'm authorized, but am I competent to perform that competency? And RNs and NPs must determine whether they have the individual competence to perform a competency. They must determine, do they have the necessary knowledge, skills, judgment, and personal attributes, which is the attitudes, abilities, behaviors, beliefs, and values, to safely perform that competency for the client? And then the thing to consider is whether they can appropriately manage the outcomes of care in their practice setting. Because you may have the necessary knowledge, skills, and judgment and attributes to perform that skill. You are authorized to do it by your employer in an acute care setting, and you're educated. You have the necessary knowledge, skills, and judgment through your education program or continuing education, but it may not be appropriate to perform that competency in a community or public health setting or in a long-term care facility. It may be appropriate in acute care, but it may not be appropriate in your practice setting. So you need to be able to consider whether you can appropriately manage the outcomes in care in your practice setting. And if it is appropriate to perform the competency in your practice setting, you also have to determine, can you effectively manage if there's an adverse outcome of care? So there may be practice settings, as I said, where it may not be appropriate to perform the nursing competency, such as in a client's home or outside of a hospital in a private self-employed setting. So consideration must be given to ensuring unintended consequences of care can be managed effectively. So do you have access to emergency service or equipment, for example, as an AED, if you're doing cosmetic procedures in a clinic setting? So all of these things need to be considered in scope of practice. And some factors that will impact the scope of practice of RNs and NPs in Newfoundland. This is just a diagram to depict those. And because we have an ever-evolving scope of practice of a profession, and it requires RNs and NPs to continuously critically reflect on their individual nursing practice to ensure that their actions and decisions are based on current evidence, best practice, and what is occurring in the broader nursing and healthcare environment. And RNs and NPs are required to respond to clients' needs by continually expanding their knowledge and skills and make judgments regarding the boundaries of their practice. So within Newfoundland, as I talked about legislation, so the scope of practice in Newfoundland is governed by and determined by the RN Act, the RN regulations, and other relevant laws within Newfoundland and Labrador. If you're working in emergencies and virtual emergencies, it could be the Gunshot and Wound Act, maybe the Fatalities Act. So these are pieces of legislation that will affect your practice setting, particularly in a virtual nursing practice. What is the Personal Health Information Act legislation that is certainly important in virtual nursing practice? And then we've talked about the college's standards, ethical code, and other relevant documents. We have a document on virtual nursing practice that is found in the practice section of our website under practice resources and practice topics. And then we talked about the individual RN and NP competencies. What is that necessary knowledge, skills, and judgment that you have within your individual scope of practice? And then your scope of practice is going to be determined by your relevant employer policies, whether that's global policies or it could be policies at your unit level. And then at the end of the day, your scope of practice is going to be governed by the client's needs. What are the needs of the population of Newfoundland and Labrador?
So far in this presentation, we have provided you with some information to reflect on when you are being asked to work within a virtual ER. So we talked about the standards practice, and we've talked about your scope of practice. So they're the things that you would have in any practice setting. So now we're going to talk a little bit about virtual nursing practice and how this is providing nurses services in a new way. So there are some expectations for you here. So when you are reflecting on the appropriateness of care, so you're thinking about the appropriateness of virtual nursing practice. So that's the context in which you are providing your nursing services. So we think about our patient population, we think about our employment context, we think about our individual competence, and really we're just ensuring that we're not unknowingly taking risks with our clients, and that we know that there are risks related to virtual nursing practice, and that we have a process in place to mitigate or reduce these risks. So when we are thinking about engaging in virtual nursing practice, whether it be in a virtual ER or through telephone advice or any other type of technology, you need to think about the appropriateness of this method to deliver nursing services, and that's with respect to an appropriate duty of care, appropriate technology, and appropriate employment support. And if you have all those things in place, then you can pretty much answer that it can be appropriate. So if you think about a duty of care, we have to understand that within all practice environments and employment situations, the appropriateness of duty to care is being provided is specific to the client, the provider, the type of care practice, the location, and the availability of supports. So your duty of care is established as soon as you have a patient come into your services. And you have to think about, is it appropriate if your client is in a different location? If you can rely on an independent third party to do a assessment, that you have to reflect on the appropriateness of the care you're being required to complete. For example, like Michelle already said, the level of assessment, physical assessment required with respect to or versus the level of assessment that can be completed virtually. And if a more detailed assessment is needed, like a face-to-face assessment, then a process does need to be in place to transfer the client to an area where that assessment can be completed. Do you have the appropriate decision-making tools and algorithms and other processes put in place when engaging in care virtually? And these duty of care, thinking about the duty of care and the appropriateness of that care, there needs to be some consistency between different care providers in providing these types of service deliveries. Then you have to think about the next part of it is the appropriate use of technology. So what is the technology that you're using? Is it Can you only speak with, do consultations by telephone? And is that level of consultation with someone enough? Is it consistent with the level of assessment or the services being provided? Do you need to have a virtual stethoscope, or do you need to have video conferencing? With your level of technology, you must also ensure that there is place to reduce the risk for the increases in breaches of privacy and confidentiality. So there needs to be some kind of cybersecurity. Ensure that you maintain your ethical and legal requirements for confidentiality in an electronic format, including your encryption of data. And with technology, it's really important to keep up to date on new processes and equipment and any other changes in the modality of care. So you need to be proficient with its operations. Therefore, if you got some education, like Michelle said, to have something added to your scope of practice, but then there was a huge gap between your education or orientation into the virtual setting, then you might need to request a refresher so that you could be up to date on that use of technology. And then a very important one is, do you have the appropriate employment support? So the employment situation should have policies and procedures in place that clearly articulates the type of virtual nursing practice, care as a primary care provider, or for consultations. Those policies and procedures or guidelines or employment support, it should be, has to articulate how you allow providers and clients to connect in a safe way while ensuring nursing practice expectations are met. So you must know and adhere to your relevant policies and protocols regarding your practice setting and your employment situation. And like we said earlier, there needs to be processes for proper patient identification, informed consent, disclosure of limitations, how privacy and confidentiality is maintained, how you document care and those conversations you have if you do have to do consultations. And you must adhere to legislation on the storage of documentation, like your custodial requirements as defined by your employment situation, and have the proper infrastructure supports in place. So, supports to minimize risk of hacker intrusions and so on and so forth. So just thinking about, you got to put the big picture together, think about your standards of practice, how you maintain them. Think about your scope of practice, what you're educated, competent, and authorized to perform. And then think about it in a virtual setting where there's the appropriate technology, duty of care, and appropriate employment support. Now, Michelle's going to end this presentation by just taking you through some resources on the college's website and how you can connect with us if you have any further questions or comments.
So if you're not aware of the new college's website, we do have a new website. And if you're looking to access our resources, you can either go through the search engine here with the magnifying glass up at the top of your right-hand screen. There's also 3 lines, which is a hamburger that you can go into, and that takes you right to a list of web pages that we have, and you need to click on practice. And if you click on practice, you then click on practice resources. And under that, we have 2 areas. Practice topics, which is where all of our documents are located, and they're organized according to topics that are within the nursing practice. And if you're looking for the virtual nursing practice, you click on that topic, and then you will see the virtual nursing practice. If you're looking for the scope of practice framework, you can click on the scope of practice topic, and under there you'll see the framework and also those suite of supporting documents that we've referred to in the presentation. So to connect with the college, we have some new platforms that we're using that you can connect with us at the college. We have a new Facebook page, and we encourage you to accept our and share our information, and we're sending out education sessions, advertisements on that through our Facebook. information that is really relevant to your practice, you can find that at our Facebook page. Then we also have Twitter, we also have Instagram, and we also have a YouTube page. And all of these education sessions that we're doing and recording and archiving, they're stored on our YouTube page. But you can also get those archived events under our archived page of our practice resources. And then our physical location is at 55 Military Road. Here's our telephone number and the toll-free number. And this is our website as well. And just a note, we are also sending out like notes from the practice team. And this is information that comes from us, the regulatory body, but also some key stakeholders with clinical information that's applicable to your practice. And generally, we're sending that out the first Monday of each month, and we've been doing that since January. So this is a way for us to connect, to let you know, here's some requirements for your practice. Here's some important information, like, your continuing competency is the new program, licensure renewal is coming soon, and all of those 24 hours of learning needs to be logged and your summative evaluation completed before you can renew your license. And you can use this session today for your CCP. And then there's information from key stakeholders. For example, the Chief Medical Officer of Health have been sending out many notifications and memos about the COVID-19 pandemic, and we've been sharing those through that notes from the practice team. So we have a wide variety of methods that you can connect with us, and you can certainly contact Peggy and I at any time at our direct numbers that you can find on our website under contact.
Thank you, Michelle. So that brings us to the end of this education session. I hope we've given you some information for you to reflect on. I am now going to stop the recording and open up the line for questions. Thank you all.